Now, you've used a number of electronic medical records and electronic health record systems. What do you like about the AZZLY system?
Well, the thing that won me over for the AZZLY system was that they paid attention to the provider doing medication assisted treatment, as it was called at the time, or MOUD as it's called now, the medications for the treatment of opioid use disorders. So if you were a practitioner who had the X waiver on your DEA and you were able to write prescriptions for individuals who needed buprenorphine for their opioid use disorder, the AZZLY system was designed to accommodate the way in which you practice. And there are electronic health records that work with doctors in their offices that don't pay any attention to the particular rules and regulations that you operate under if you're treating someone with a substance use disorder, including the additional protections that have to be in that record. There are electronic health records that work with treatment providers that don't take into account how the individual medical practitioner does his or her work. The AZZLY system decided to take that on, was the first in its class to take that on, and actually does it quite well. So it's quite responsive to a physician who may be seeing people for hepatitis C, which, by the way, is surging now and has started to surge during COVID, who may be seeing people for their liver disease, but also wanting to treat their opioid use disorder. That record can be superimposed on what they're using in their office and allow them to keep the records adequately for the medication treatment of the opioid use disorder. I like AZZLY because it recognized how I had to modify my practice in order to treat medications for opioid use disorder. And they took that on when a lot of people wouldn't take that on. They're first in class.